Good. Thank you very much for joining me. I'm sorry that was such a kerfuffle. Um, but thank you, really appreciate it. And thank you for everyone who has joined us on our Instagram Live. Like I was saying before, it's our Instagram Live for Awareness Week, all about psoriatic arthritis. So hopefully we can, well, Laura can answer some of your questions. Um, I'm Georgia, obviously I'm from the Psoriasis Association. I do the website and the social media. I'm the digital communications officer, but I also live with psoriasis and psoriatic arthritis myself. Laura, I didn't know if you wanted to introduce yourself a little bit to let everyone know who you are.
I'm Laura Coates. I'm a rheumatologist and a researcher. I'm based at the University of Oxford, and live in Oxford and have done for the last 8 years. Um, I have a particular interest in psoriatic arthritis. I run the psoriatic arthritis service in Oxford, and I also do a number of research studies looking at psoriatic arthritis and psoriasis.
Great, thank you. And obviously, like I said as well, thank you for joining us. So hopefully we will get some questions through, but I have got some just prepared just in case, just to get us started. So maybe we could just start with the basics of what are the symptoms of psoriatic arthritis?
So psoriatic arthritis is a type of inflammatory arthritis. So you get joint pain. The arthritis bit means inflammation in joints. And so the most typical issue is joint pain. It can, however, affect other bits of the body. So it can affect pretty much any joint. Obviously, most people have psoriasis, not all. So some people have a family history of psoriasis, but they may not have the skin rash themselves. But it obviously runs in their family. Probably up to half of people can get involvement in their spine. So they get inflammation and stiffness and pain in the back. And then we also get a lot of patients who have symptoms around the tendons as well. So they get inflammation in the tendons that can typically cause heel pain. So pain in your Achilles tendon at the back of your heel or underneath your feet. But it can affect any tendons in the body.
Thank you. Yeah. Um, I suppose as well, what this is quite basic as well, but what should people do when if they notice they're having those symptoms of psoriatic arthritis?
Yeah, so that's really important. So we want you to raise awareness with your GP, usually in the UK first, and talk to them about a referral to rheumatology. So typically, the NHS is under quite a lot of pressure nationally, and there's quite long waiting lists. But we do have an aim to see patients with new inflammatory arthritis, of which psoriatic would be one type, within 3 weeks of referral from the GP. So there's often a different pathway. If your GP is referring you for a slightly achy knee, there's often a longer wait. But if they think it could be psoriatic arthritis, then we would typically see you much quicker.
Hmm.
I think it's worth raising the query of whether this is psoriatic arthritis, if you have psoriasis, or if you have a family history of psoriasis, and whether this could be related. And unfortunately, at least at the moment, we don't have a good diagnostic blood test that GP can do that really makes a diagnosis. So you really need to be seen in rheumatology. But if you have significant joint pain, joint swelling, and that's not settling, then I would see your GP and ask to be referred through to rheumatology.
Mm. That's actually leads on quite nicely to someone's just asked in the chat there, how is it diagnosed? It can be quite difficult to diagnose it, can't it? Is it right in saying that there's a sort of like by eliminating other things really and then looking at like your bloods and your x-rays and things? Is that right?
Yeah, so it can be really tricky to diagnose initially. There isn't a magic blood test.
Mm.
So we look at clinical examination. So as rheumatologists, we would want to see you, examine the joints, feel for swelling, see what's tender, think about whether your back could be involved or your tendons could be involved. If we're not sure, we typically use ultrasounds to help us. So we can do x-rays. If you've had symptoms for a long time, then x-rays can be helpful. But often the x-rays are normal. So actually the ultrasound allows us to look inside the joints and see if there's something going on in the joint, see if there's inflammation there. That's probably the most useful test. We also do basic blood tests and we look for inflammation on the blood test. But in up to half of people with psoriatic arthritis, even if they have active inflammation, they don't have anything on the blood test. So
Mm,
it doesn't necessarily help. It can be normal, and it doesn't mean that you haven't got psoriatic arthritis.
yeah, thank you. Someone has just asked here as well, this is a good question. Can it come and go? As in the pain, can it wax and wane?
Yeah, absolutely. So psoriatic arthritis typically comes and goes over time.
Yeah.
So it typically flares up. Some people find that particular things make them flare up. So it might be that you've had a really busy day, that you're stressed, that you've been doing more physically, or you're emotionally more stressed, and that can cause a flare up. Some of our patients say that they just flare up without any reason or warning. So there's no good reason why it happened, it just does. And then often it will settle down a bit in between. We have some patients where it can flare up really badly and they can go back completely to normal, no symptoms at all for a while, before it then comes back again. I guess probably more commonly, at least the patients that I look after in the hospital, so who've been referred and diagnosed, they have kind of grumbling symptoms maybe there most days, but it can be much more severe some of the time with a flare.
Yeah. I know, for like I say, because I have psoriatic arthritis. I know for me, the weather can really trigger both my psoriatic arthritis and my psoriasis. When it gets quite cold, I do notice a change in my symptoms there. Oh, someone's actually just asked, why does psoriatic arthritis seem worse in the winter? Is there a reason behind the cold weather making it worse?
I mean, I think generally everything is a bit worse in the winter. There was a really interesting study a few years ago that looked at lots of types of arthritis, not specifically for psoriatic arthritis, but lots of different types of arthritis, and it was called Cloudy with a Chance of Pain. And they have really good information. They asked lots of thousands of people with arthritis to score their pain every day on an app, and they linked that to where their home was using the location so that they could pick up what the weather was like. And they found that generally people are worse when it's cold or when it's damp. I have, however, had some patients who feel much worse when it's dry and sunny. So
Yeah.
there is a minority who are worse in the summer, but I think most people struggle more in the winter when it's cold and damp with joint symptoms.
Yeah, and with it's the same as psoriasis as well. That it's important to remember that everyone's different. Like everyone's triggers and what makes them flare up are different. So for what makes someone flare up might not affect someone else at all. So yeah. I did have another question there, but I'll just scroll past it. So I'm just having a look. I don't know if you be able to answer this one. It could be quite specific. And I'm sorry if I say the condition wrong. Is it common to have I'm sorry, I don't know how you say it. Is it Ehlers-Danlos
Oh,
syndrome?
Ehlers-Danlos and PSA, yeah. Um, the short answer is probably no. Um, so Ehlers-Danlos is it's a condition that causes flexibility
Mm,
at the easiest end. At the more severe end, it can also affect blood vessels and other things as well. So milder forms of Ehlers-Danlos, people are very flexible. Their joints move a long way, and that definitely causes joint pain. At the much more severe end, it affects blood vessels, and that's a much more serious issue. They have similar symptoms in terms of joint pain. There's no reason that you couldn't have them together, but it's not particularly common.
Yeah, thank you. Someone's just asked here as well. My 8-year-old has recently been diagnosed with psoriasis. Do many children develop psoriatic arthritis?
Yeah, so we actually look for it a little bit separately.
Mm.
So we look at something called juvenile idiopathic arthritis, which is the type of inflammatory arthritis we see in kids. And one of the types of juvenile idiopathic arthritis is psoriasis associated. So essentially, it is kind of the same as psoriatic arthritis. There's some important differences in the way that it presents, some similarities in the way that we treat it. But typically, you would be looked after by a rheumatologist with more of an interest in either caring for children or a paediatrician, a children's doctor who also does rheumatology. So it can happen. And we're actually doing some research with a team in Manchester to try and sort of compare and contrast how kids with psoriatic arthritis get on and how adults with psoriatic arthritis get on, how they're similar and how they're different. So at the
Mm.
moment, we sort of consider them a separate condition, but actually there are quite a lot of similarities.
Yeah. I was actually going to ask, can anyone, yeah, you can be diagnosed with psoriatic arthritis at any age, because I think there's often a bit of a common misconception that osteoarthritis can sometimes be known as like an older person's condition, but
Yeah.
that's actually not true. So I'm just seeing some of the questions there. Also, I don't know if you can answer this one. What can you do about hair loss with psoriatic arthritis?
Yeah, so I think it depends what's causing the hair loss, for the
Mm.
question about hair loss. So we do see hair loss with methotrexate, which is a common drug that's used for psoriasis and psoriatic arthritis. That slows down rapidly growing cells, and that includes your hair cells, which are growing. So it typically causes some hair loss or hair thinning. Usually, we don't see hair loss directly caused by the psoriatic arthritis, but obviously you can also get some interference with the hair if your psoriasis is bad on your scalp.
Yeah, yeah. Someone there's also just asked if they've been diagnosed with psoriasis, how likely is it that they'll get psoriatic arthritis?
So up to 1 in 3 people with psoriasis get a related arthritis. It's probably slightly lower than that. It's between 1 in 5 and 1 in 3. It's a bit more likely if your psoriasis is worse. It's definitely more likely if you have psoriatic arthritis in the family, not just psoriasis in the family. And that's over your lifetime. So the actual chance of developing psoriatic arthritis each year is quite low. And it typically happens many years after you've developed psoriasis, but it's something to be aware of and to sort of think about screening for.
Mm, yeah, just seeing there. Is medication only required when managing flare-ups? That's quite a good question.
Yeah, so I think that depends. I see people with mild psoriatic arthritis who don't need to be on medication all the time. The medications that we use do require regular blood tests. They can be quite a lot of hassle.
Mm,
And if you have very mild disease that comes and goes, but can be fine in between, then it's not worth taking a drug every day to do one. More of the patients that are under my care, that stay under the care of rheumatology, have more persistent disease that doesn't go away or that flares up more frequently. And so it's always a balance between the risks of taking medication, the side effects and the hassle, versus the benefits of whether it keeps things under control. It's absolutely different for everybody.
yeah,
So it should be a shared decision that your doctor makes with you about how your arthritis is affecting you and how much you want to try medication. For example, we have some patients. I have a patient at the moment who's a surgeon and his hands are affected. And he can't risk not being able to operate on somebody or a joint flaring up before a long day of operations. So it's much more important for him to be on medication. We've had similar things with musicians, for example, who play cello and something and need their hands to be absolutely perfect, so as good as we can get them. If it's more significant and more of a problem, then it is worth being on medication every day to stop it flaring up, to keep it under control, and to hopefully get you back to a normal life. And I
Yeah.
think that decision includes both the joints and the skin. So I
Mhm.
have some patients where the joints are not so bad, but actually they're on methotrexate to keep the skin under control, almost more than the joints. But both things are benefiting. So I think it's that choice, and it's definitely up to you and something we want to discuss the kind of pros and benefits.
Yeah, definitely. It's all very personal, isn't it? Like you say, it's how it
Yeah.
affects you day to day. Yeah, because I'm on methotrexate, and I wouldn't have gone on that for my psoriasis, but it was when I had the psoriatic arthritis, and I thought, okay, yeah, this is getting a bit. I've got to like have something really to get control of it, and I am glad now that I've done that. But I understand it's all personal choice, isn't it? So yeah, it is. Thank you for that. Gosh, I've got quite a few coming in now. So right. Someone just asked a question about fatigue. I often get fatigue through the day. Often, then really don't matter how much sleep I get. Just the overall feeling of being drained day to day. Is that also quite common with psoriatic arthritis?
Yeah, unfortunately, fatigue is a big problem in psoriatic arthritis. And actually, that person's really described fatigue beautifully. It's not being tired. It's
Mm.
not that you feel sleepy because you didn't sleep well. It's completely separate to how much sleep you get. You do just feel drained and fatigued, and that's really hard to manage. I think it's tricky in arthritis because sometimes that's caused by active arthritis,
Mm-hmm.
and we need to control the disease a bit better, particularly if you're getting joint pain or joint swelling alongside the fatigue. Sometimes the medications can cause that, so it's worth having a conversation about whether it could be related to medication, in which case you need less medication or a different medication. And sometimes we see it kind of as almost a knock-on effect of having active arthritis. So the arthritis might have been brought under control, but a lot of patients suffer with more ongoing joint pain or fatigue that can be really hard to manage. And some of that is due to the fact that your body really has just been tired out by the arthritis. And it takes quite a while to get things back to normal and to try and start doing, a bit more your daily life, and kind of build things up gradually. But often there are teams in physiotherapy,
Mm-hmm.
or other kind of clean teams who can help manage that idea of getting back to normal life gradually.
Yeah, thank you. Gosh, I've got quite a few coming in now. Um, Someone asked her, how often should you have blood tests to check your medication isn't affecting your organs? I think that all depends on the type of medication you're on. Is that right?
Yeah, absolutely. So when you first start on the medication, we typically check bloods more frequently because we don't know if it's going to suit you. Often that's every 2 weeks or every 4 weeks when you first start on a medication, particularly a drug like methotrexate. Once you're stable on a drug like methotrexate, it's typical to have blood tests every 3 months, so 4 times a year, if we know that you're stable on it. For the newer biologic medications, we see less problems with blood abnormalities, so we don't need to check them as often. And then it's typically every 6 to 12 months. There are a few newer drugs as well that don't require very regular blood tests. So a Premlast, for example, officially doesn't need any blood monitoring, but often as a rheumatology team, we would check it at least once a year just to make sure that we're on top of things and picking up any issues.
Yeah, thank you. Someone's just asked a question that I was actually going to ask about lifestyle. Is there anything you can do, like changes to your lifestyle or anything holistically that might help psoriatic arthritis? Because that is something we hear about a lot as well. Obviously, people wanting to help themselves holistically rather than going on medication. So, is there anything that people can do to help?
Yeah, so I think there are lots of things that you can do either instead of medication if your disease is mild, or as well as medication if you also need medicines to manage it as well. So I think maintaining a healthy body weight is really important. That helps the drugs work better. So we know that patients who are significantly overweight, the medicines don't work as well. And obviously you're putting more pressure through your joints when you're moving about. There's a lot of questions about diet. So there's a lot of interest in diet, usually from patients, about what might make a difference. And I would say there's a reasonable amount of data out there around sensible diets that can be helpful. So a Mediterranean type diet with olive oil and low processed food. There's a bit of evidence around that. Those diet studies are really hard to do. There was a diet study reported last week at the American conference I was at, where they'd randomized people to different diets, to a Mediterranean diet or a kind of standard low calorie diet or a very brief dietitian visit. And actually, the improvement in the arthritis linked only to how much weight people had lost. They were all people who were overweight. The type of diet didn't seem to make a difference. But I think generally low processed food and a kind of Mediterranean type diet. And then in terms of supporting your joints, it's important for anyone to have strong muscles around the joints because that helps with joint pain and supports the joint. But if you have damaged joints or inflamed joints, that's even more important. So keeping that bit of strength in the joints, things like grip strengthening exercises, so squeezing like a squeezy ball to keep the strength in the hands, helps keep them mobile and strong. And just standard, very simple strength exercises, lifting shopping bags, going up and down stairs, the squats, anything that strengthens the muscles will help.
Mm, thank you. It's interesting that you say about diet. 'Cause obviously, our theme this week for Psoriasis Awareness Week is comorbidities, and have been talking about diet and how that can help both psoriasis and psoriatic arthritis. So it's very topical at the moment. A lot of people talking about things like that. So yeah, we did actually post a video about it for the research from Dr. Marifapu, which she did, the Apple study, which is quite interesting if anyone wants to check that out on our YouTube. Just seeing if there's any more questions here. Someone said this was quite also specific. Um, can you only be prescribed a biologic if methotrexate doesn't work?
Yeah. So the requirement in the UK, both in skin or in joints, is that you have to have cheaper conventional drugs first. That's because those drugs are good for a significant proportion of people and they're much cheaper and they've been around for a long time and we know how to manage them. And they can be really effective therapies. But it's really only for cost reasons that we restrict access to biologics. If you have bad psoriasis, you have to have tried tablet medication or light therapy before you're given biologics. And if you have psoriatic arthritis, you have to try 2 different standard tablet medications before biologics would be funded. Interestingly, we did do a bunch of studies recently, some in the UK, some in the Netherlands, some that were mine, some that were not, that looked at whether having biologics right at the beginning when you're first diagnosed might improve your outcome. And for most people, it doesn't seem to. So you can do just as well with methotrexate and going up to other drugs if you need to, kind of over that first year of treatment. But potentially for people who have more severe disease, so really lots of joints involved, or very impacted or limited by the arthritis, then there probably is an argument either for using two of the cheap drugs early or early access to biologics.
Yeah, thank you for that. That's really interesting. I think a lot of people don't know the process of how they get onto treatment, so thank you. There was a question here which I was going to actually ask you about. Obviously the HPOS study, and someone did ask about what research is being done, and obviously you're joining from the HPOS study Instagram account. So I was just wondering if you could maybe tell us a little bit more about that, what the study is, how can people get involved?
Yeah, I'd love to. So the HPOS study is a big study led by a big European consortium. So there was a big European group that got together, now started probably around 10 years ago, a group of academics from across Europe, so about 15 different universities across Europe, a number of drug companies who make drugs in the psoriasis and psoriatic arthritis space, and a whole bunch of patient research partners and patient organisations. And we got together to try and work out if we could get a big funded project to try and improve the care of psoriatic arthritis. And we did that about 4 years ago. We have got funding of around 12 million from the European government and maps funding of about 12 million euros from drug companies in the space to do research. And we're looking at a number of different questions, but one of them is, can we predict who's going to get psoriatic arthritis? And the aim of the HPOS study is to recruit a massive cohort of patients across Europe who have psoriasis, who don't yet have psoriatic arthritis, and to follow them over time to see who gets the arthritis. You sign up online on our website. You don't have to come to the hospital or have any visits in person. We ask you to fill in some information about you, who you are, what your psoriasis looks like, and to fill in a quick questionnaire about throat symptoms to see if you might have psoriatic arthritis. If your scores are high on that psoriatic arthritis questionnaire, we'd advise you to get help, and we'll follow you up to see if you develop or get diagnosed with arthritis. If you don't have any symptoms, then we'd ask you to fill in some more questionnaires every 6 months to keep an eye on you. And we've got over 5,000 participants now, over 2,000 of them in the UK, another 2,000 in Ireland. We're also recruiting in Greece, Portugal, Netherlands, Germany, Norway, a whole bunch more countries coming online. And we're trying to get to 20,000 participants. We're at a bit over 5 now. So if you don't yet have psoriatic arthritis, then please have a look at our website, HPOS.study, and think about joining and becoming part of our cohort. It's only a quick online questionnaire every 6 months. If you do have psoriatic arthritis, but you have family members with psoriasis who would be interested, then please let them know. We'd be really interested to follow them up and offer them support if they do get diagnosed.
Thank you for that. It's really interesting. Um, is there any other requirements to get involved, or is it just literally just have psoriasis and you don't have that diagnosis of psoriatic arthritis yet, or is there any?
That's basically it. We need patients over 18 who can consent, but otherwise, all good.
Yeah, cool. Thank you. Just seeing if there was any other questions that we didn't get to ask. What treatments is there? This is one that I think is quite people might not know much about. Can you link the website somewhere, but I will pop a link up. But if you follow us, then I'll put it on our stories afterwards. But we always reshare about the study anyway. So if you look on our profile, you'll find it. But I will pop a link up about the study afterwards as well. I was going to ask about if someone doesn't have psoriasis, well, they don't have any skin symptoms, but they start getting joint symptoms, so aching and things like that. Can you have a diagnosis of psoriatic arthritis before you have an official diagnosis of psoriasis?
Yeah, so you definitely can, and we diagnose some people who don't have skin psoriasis first. Probably 70 to 80% of people have psoriasis before they develop arthritis. About 10 to 15% of people get diagnosed together because they
Mhm.
develop skin and joints quite close. And then a small number, probably only 10% or smaller, gets the arthritis first and then psoriasis. And I definitely have some people who are diagnosed with psoriatic arthritis who've never had psoriasis, but they have it in the family or they have some other features. So lots of people get inflammatory arthritis, things like rheumatoid arthritis, which often people have heard of as well, which is another type of inflammatory arthritis.
Mhm.
But if you have a family history of psoriasis, if you have nail disease, so nail changes that fit with psoriasis, or if you have what we call dactylitis, then it's much more likely to be psoriatic arthritis. And dactylitis is where you get swelling of a whole finger or toe that swells up a bit like a sausage. So not just the individual joints, but the whole thing kind of swells up like a tube. And that's a very typical feature of psoriatic arthritis. So very occasionally we diagnose it without a family history, but with dactylitis.
Thank you. I think that is quite one people don't really know about, that they can have that without the psoriasis, like a diagnosis first. I'm just going to see if there's any more. Oh, someone said thank you for doing the research. It helped me get the help I need. That's really nice. Um, yeah, there's any questions I missed? Does anyone else have any other questions I'd like to ask? This is interesting as well. Is psoriatic arthritis the same as rheumatoid arthritis?
It has a lot of similarities. So they're both a type of inflammatory arthritis. So not the kind of wear and tear arthritis that older people get, but inflammation in the joints. Some people with psoriatic arthritis look really, really similar to rheumatoid arthritis patients. It affects lots of joints all at the same time, and you get a very similar pattern of disease. But I think generally I would say psoriatic arthritis is more variable.
Hmm.
Patients with rheumatoid, their disease tends to look the same. They tend to have many joints involved. It nearly always involves the wrist and the small joints in the fingers. Whereas psoriatic arthritis is just really variable. It can affect any joint in the body. Sometimes it only affects one joint. Sometimes it only affects two or three. Sometimes it affects tens all at the same time. So it's really much more variable. We have a few people where we're not quite sure whether they have rheumatoid or psoriatic arthritis. We have a few who kind of are in that grey area in the middle, and we think very carefully about how we treat them, and we potentially keep an open mind and change our mind over time as well. So there are a lot of similarities, but the rheumatoid arthritis patients don't get the same involvement in the spine and the same back pain. They don't get the dactylitis, the sausage toes, and they don't typically get the tendon problems that we see in psoriatic arthritis as well.
Thank you. Um, Someone here has actually asked quite a good question as well. Katie, no, that actually hasn't been asked. Is there like like any categories we're likely to get PSA? So women, men, well, we did speak about age and lifestyle a little bit, but it doesn't really matter women or men, does it? Or
Yeah, so it's about equal men and women. So rheumatoid
Yeah.
arthritis is much more common than women. Psoriatic arthritis is about the same, equal men to women. Um, age can happen at any time, as we said. So we only look after 18 plus, but it can happen as a kid. It's more likely if your psoriasis is bad, and if you have a family.
Someone here has also asked a question, but I don't know if um, is it time to consider a new PSA priority setting partnership? I don't know much about that. Sorry, are you
So, so I
okay?
think ours was only a couple of years ago.
Mhm.
I think there's still a lot of questions that we're working on. I wouldn't necessarily change things at the moment, but we do have to keep those things in mind.
Thank you. Has anyone else got any more questions? If not, then probably wrap it up. Seeing if there's any I missed, but I don't think so. Um, oh, I don't think there's any more. So, thank you everyone for joining. I hope you enjoyed it, and thank you, see very much, Laura. That was really, really insightful. Oh, someone just asked if psoriasis can cause hair loss. We did speak a little bit about that earlier. Psoriasis can cause hair loss possibly if you have scalp psoriasis, and that's if the scalp psoriasis is really thick, that it's not obviously the hair follicles are not able to get through, but that is normally temporarily. Um, but oh, everyone's just saying thank you. Oh, thank you, everyone. No, thanks. I hope you all enjoyed it. And yeah, like I said, thank you very much, Laura. That was really insightful. I'll post a link to the HPOS study, but like I said, we do link it a lot anyway. It's also on our website, but I'll post one up on our story if anyone was interested to check it out afterwards. So yeah, thank you very much, everyone. I hope you have a lovely evening. Enjoy the rest of Psoriasis Awareness Week. The last day is tomorrow. But yeah, hope you've enjoyed what we've done so far already. So thank you. Thanks, Laura.
Thank you.
Take care. Bye.